We are going to now look at anatomy of the spinal cord. The specific things we're going to learn in this session are the following. We are going to look at the extents and enlargements of the spinal cord. We're also going to look at we are going to outline the origin and organization of a spinal nerve. We look at the internal structure of the spinal cord, and then we'll also look at the major tracts of the spinal cord, and we'll state their key modalities. So the spinal cord is located within the vertebral canal. It extends from the medulla oblongata. This is the region of origin of the spinal cord, the medulla oblongata. And it extends all the way to its termination. The termination of the spinal cord is known as the conus medullaris. So from the level of the medulla oblongata, which coincides with the level of the foramen magnum, the spinal cord extends up to its termination. The termination of the spinal cord, where I'm pointing at, is called the conus medullaris. But the anatomical level of the conus medullaris varies with age. In adults, it's that level there, coinciding the level between the first and the second lumbar vertebra. That is in adults. At the time of birth, the conus medullaris will be ending somewhere here, at around the third lumbar vertebra. When the fetus is in the embryo, in the uterus, at around the 6th month, the conus medullaris will be extending up to somewhere here, the first sacrovertebral level. And at the beginning, up to maybe the 3rd month of fetal life, the spinal cord and the vertebral column were at the same length, extending all the way to the coccyx. So what does that mean? It means that as you grow, whether intrauterine or postnatal, the spinal cord appears to shorten relative to the length of the vertebral column. It does not mean that the spinal cord actually shortens. The point here is that the vertebral column grows faster than the spinal cord. So the vertebral column outgrows the spinal cord. And if the brain is on the other end, and the spinal cord is attached to the brain, then the spinal cord can just continue hanging upwards because the vertebral column is growing faster than the spinal cord. So the vertebral column outgrows the spinal cord. Otherwise, at the beginning, the spinal cord and the vertebral column were at the same length, all extending to the level of the coccyx. The spinal cord gives you pairs of spinal nerves. We have a total of 31 pairs of spinal nerves. These 31 pairs of spinal nerves are distributed as follows. In the cervical region, we have 8 pairs of spinal nerves. We name them C1, C2, C3, all the way to C8. Don't confuse the pairs of spinal nerves in the cervical region with the number of vertebrae in the cervical region. The number of vertebrae in the cervical region are 7, but the pairs of spinal nerves in the cervical region are 8. Thoracic region has 12 pairs of spinal nerves named T1 to T12. Lumbar region has 5 pairs of spinal nerves named L1 to L5. Sacral region has 5 pairs of spinal nerves named S1 to S5, and coccygeal region has only 1 pair of spinal nerves. Now, if you look keenly, you'll notice that those nerves are still coming out through their respective vertebral levels, in as much as the spinal cord has shortened, and in adults terminating at around L1, L2 junction. This is because in as much as the spinal cord shortens in the manner that I've described for you, the nerves that were coming out of it will still retain the attachment to the spinal cord. And so what will happen is that the lower part of the cord will appear like the nerves go down first before they come out. The spinal cord has 2 enlargements. There's an enlargement in the cervical region, and you can appreciate that here. This region appears slightly enlarged. The cervical enlargement of the spinal cord give rise to the brachial plexus. So the enlargement is because there are many nerves which come out from those segments of the cord. We have another enlargement down here, which we call the lumbar enlargement. The lumbar enlargement give rise to the lumbosacral plexus, which innervates the lower limb. Again, the understanding is that there are many nerves which come out from that segment. So if all those nerves have their cell bodies within the cord, then definitely we'll expect the gray matter within there to be expanded a bit compared to the other segments of the cord where we don't have many nerves coming out. So with reference to what I described to you earlier of the spinal nerves still retaining their exit points according to the vertebral levels, despite the fact that the spinal cord has shortened, it means that when they enter, they'll appear to go up first before they attach the cord. And so the lower part of the spinal cord appears to have many nerves in a group. This group of spinal nerves below the level of the conus medullaris look like the tail of a horse. Therefore, we call it the cauda equina. So this is the cauda equina. The spinal nerves below the level of the conus medullaris, the group of spinal nerves below the level of conus medullaris, cauda equina. Let's look at the internal anatomy of the spinal cord. In cross-section, the spinal cord has this depression here, a bit deeper on the anterior side. We call that the anterior median sulcus. You can call it ventral median sulcus, this one. Dorsally, we have these 2 depressions, which we call the posterolateral sulcus or dorsolateral sulcus. Dorsolateral sulcus or posterolateral sulcus. So that helps you to orient yourself on which part is in front and which part is behind on the spinal cord. This is the front one. The deepest sulcus is in front. And so this is posterior. So this is posterolateral. At the center of the spinal cord, we have a canal. We call it the central canal of the spinal cord. The central canal of the spinal cord contains cerebrospinal fluid. Having said that, we then expect that it is lined by ependymal cells. The ependymal cells of the spinal cord is just one layer of cells. So they appear epithelial. You can actually just call it simple columnar epithelial lining. But remember, those which you are calling epithelial are actually neuroglial cells, the ependymal cells. These ependymal cells have ciliary activity that help to propel CSF along the central canal against gravity. The second component of the spinal cord cross-section is this region here, which looks like a butterfly. We call it the spinal cord gray matter. The spinal cord gray matter it's a compact zone of cell bodies of neurons. We'll be talking about it shortly. The outer part of the spinal cord is this region here, which we call the spinal cord white matter. The spinal cord white matter contains axons of neurons. So let's talk about the spinal cord gray matter. We are saying this is spinal cord gray matter, which is a compact of cell bodies of neurons. The spinal cord gray matter take this shape of butterfly or H-shaped. It has 3 horns. This is what we call the anterior horn. The anterior horn is also called the ventral horn. The ventral horn of the gray matter contain cell bodies of somatic motor neurons. These are the neurons that come out from here to go to skeletal muscles. Their cell bodies are here. They are the cell bodies of the lower motor neurons. The cell bodies are here, but their axons come out to go to supply skeletal muscles. So somatic motor neurons. This is the region of the spinal cord that is usually targeted by the poliovirus. And that's why polio causes paralysis. This one here is called the dorsal horn of the spinal cord. This dorsal horn or posterior horn of the spinal cord gray matter receive sensory nerves. All sensory nerves that enter pass through this root of the spinal cord as opposed to this root of the spinal cord. So the neurons that pass through this root of the spinal cord, some of them synapse here within the dorsal horn of the spinal cord. Therefore, the dorsal horn has a sensory function. Those 2 horns of the spinal cord, whether anterior or posterior horn, are present in all segments of the spinal cord, from C1 all the way to coccygeal 1. All segments of the spinal cord contain these 2 horns. But there's another horn called the lateral horn. The lateral horn of the spinal cord, which you can also call the intermediate horn of the spinal cord, contains cell bodies of neurons which are autonomic in function. So remember, for autonomic nervous system, we have preganglionic and postganglionic neurons. So the preganglionic neurons are the ones that rise from the central nervous system, either brainstem or spinal cord. So from the spinal cord, they come out from the lateral horn of the spinal cord, which means that the lateral horn of the spinal cord contains cell bodies of preganglionic autonomic neurons. Therefore, the lateral horn is not present in all segments of the spinal cord. The segments of the spinal cord that will contain a lateral horn are segments which have autonomic function. For the sympathetic nervous system, these segments will be all the thoracic segments together with the upper lumbar segments. It can end at lumbar 2 or lumbar 3. That is sympathetic. For that reason, we call sympathetic nervous system the thoracolumbar outflow. For parasympathetic, the parasympathetic nerves usually come out from either a cranial nerve or sacral nerves. And so we call parasympathetic cranial sacral outflow. The cranial nerves which are parasympathetic are only 4. The 3rd nerve, the 7th nerve, the 9th nerve, and the 10th nerve. I know I asked you to talk about that in your assignment. You'll still go check on, so what are they parasympathetic to? The sacral nerves which are parasympathetic are the S2 nerve, S3 nerve, and S4 nerve. So S2, S3, and S4 are parasympathetic to the visceral organs of the pelvis. So those are the regions that we'll expect to have a lateral horn, because they're the ones that give rise to autonomic neurons. So I've already answered this question for you. I'll not post it on the poll. But I want you to answer it in the chat. So this is what you're going to do. I've enabled the chat in such a way that I'm the only one who will see what you've written. So respond in the next 1 minute. Say whether it's A, B, C, or D. I'm waiting. 1 minute you have. I'm looking at the responses you've made, and kumbe anatomy ni ngumu sana. Anyway, the correct answer is A. So those who didn't write A, you'll go revisit the video. Let's talk about the spinal cord white matter. The spinal cord white matter contains axons of neurons. This spinal cord white matter can be grouped into 3. This region of the spinal cord white matter is what we call the posterior column, or you can call it the posterior funiculus. Funiculus means column. This is the posterior funiculus. Then this region of the spinal cord white matter is what we call the lateral funiculus, or the lateral column. This region of the white matter is what we call the anterior column. So we have 3 columns of white matter: anterior, lateral, and posterior column of white matter. These columns of white matter contain axons of neurons which can either be going up or going down. The ones which go up are called the ascending tracts. The ascending tracts have a sensory function. The ones which go down are called descending tracts. The descending tracts have motor functions. They go down, they're efferents. The ones which go up are afferents, they are sensory. So what are some of the main ascending tracts of the spinal cord? There are quite a number, but I'll teach you maybe 3 only. We have those tracts which are found within the dorsal column. We actually call them the dorsal column. The ones which are found within the dorsal column, which are called the dorsal column tracts, are responsible for the following kind of sensations: vibration sensation, proprioception, fine touch, and what we call 2-point discrimination. So I'll repeat: vibration, proprioception, fine touch, and 2-point discrimination. Those are the kind of sensations which are relayed by the neurons found within the dorsal column. Within this dorsal column, there are 2 key tracts: fasciculus gracilis and fasciculus cuneatus. The term fasciculus means tract, and we had defined that tract some time back during our introduction. We said that tract is a group of axons with similar function, as opposed to peduncle, which is a collection of different tracts. So here, fasciculus gracilis, or the gracile tract, fasciculus cuneatus, or the cuneate tract, are part of the dorsal column. I've told you their key role. They carry sensation regarding vibration, proprioception, fine touch, and 2-point discrimination. Now, why the 2? Fasciculus gracilis particularly carries sensations from the lower parts of the body. Fasciculus gracilis carries sensations from the upper part of the body. The junction between lower and upper part of the body is T6 and T7 segments of the spinal cord. So the sensations that enter below T6 are carried by the fasciculus gracilis. The sensations that enter above T7 are carried via fasciculus cuneatus, which means sensations that come from the upper limb will be carried by fasciculus cuneatus, as opposed to sensations that come from the big toe, which will go via fasciculus gracilis. The second ascending tract that I want to teach you is the spinothalamic tract. The spinothalamic tract is found in the anterior and lateral aspects of the spinal cord white matter. So some people call it the anterolateral tract. The spinothalamic tract, as the name suggests, comes from the spinal cord to the thalamus. Spinal cord to thalamus, spinothalamic. These are second-order sensory neurons that carry the following sensations: pain, temperature, crude touch, and pressure. Pain, temperature, crude touch, and pressure. Those sensations are carried via the spinothalamic tract. They are second-order sensory neurons. I forgot to tell you that the dorsal column tracts are first-order sensory neurons. And I want you to think through what I'm telling you, because it has a lot of clinical implication. I defined for you what are first-order, what are second-order, what are third-order sensory neurons during the introduction. I also told you that second-order sensory neurons decassette. So if I'm saying that spinothalamic tracts are second-order sensory neurons. It means they have already decussated, which means if they're carrying sensations regarding pain, temperature, touch, and pressure, those sensations, even though this tract is on this side of the spinal cord, those sensations are from this side of the body. They are from the opposite side because these are second-order sensory neurons. But these ones are first-order sensory neurons, which means if they are carrying sensation regarding vibration, proprioception, fine touch, and two-point discrimination, those sensations are actually coming from the same side as these ones. These ones will be carrying sensation from this side. These ones carry sensations from this side. As opposed to the spinothalamic, where this spinothalamic here, the one we are looking at right now, is carrying sensation from the opposite of the body. And these two as well carry sensation from the opposite side of the body. They are second order. And the implication of that is in terms of evaluating a patient who has a spinal cord injury. And it doesn't have to be a cut in a road traffic accident. It could just be as little as just a tumor pressing on this part or this whole side. And you have to make a decision. At what level is this thing causing injury? You have to make a clinical decision even before you send the patient for imaging. Okay. The third sensory tract I want to talk about is the spinocerebellar tracts. These ones are on the edge of the lateral column. The spinocerebellar tracts, as the name suggests, come from the spinal cord to the cerebellum. Now, you remember cerebellum does not really have levels of consciousness. The consciousness is usually achieved at the cerebral cortex. And so the neurons which go to the cerebellum are subconscious. The functions here are subconscious. And the key function that we want the cerebellum to have knowledge about is knowledge about body position. And so therefore, spinocerebellar tracts carry information regarding unconscious proprioception, as opposed to the dorsal column tracts, which carry conscious proprioception. The spinocerebellar tracts carry unconscious proprioception, sense of position that the patient is not conscious about. It explains to you why sometimes you go to sleep, you don't remember that you turned on the bed, but you'll wake up in a different position and you realize you didn't fall. Okay, I hope so. Those are the key ascending tracts I want to teach you, but I also want to teach you some key descending tracts. The descending tracts are the ones in red. Again, there are so many, but I'll teach you just a few. I'll teach you what qualify to be called pyramidal tracts. For descending tracts, you usually have two types of descending tracts. Remember, descending tracts are upper motor neurons. These upper motor neurons are classified as pyramidal and extrapyramidal. The pyramidal tracts, sorry. The pyramidal tracts, as I mentioned earlier, are neurons which come from the cerebral cortex. Extrapyramidal tracts come from the brainstem. They all go down to innervate muscles. The neurons which come from the cerebral cortex, which are called pyramidal, can either come from the cerebral cortex and terminate in the brainstem. Those ones are known as corticonuclear. Of course, we will not expect those ones now in the spinal cord because they just end in the brainstem. Those ones terminate to cranial nerves, which supply skeletal muscles. So they'll terminate to the nucleus of the third nerve, the fourth nerve, the fifth nerve, the sixth nerve, the seventh nerve, and 9, 10, 11 nerve. because those are the ones which have motor functions. But you can also have neurons which come from the cerebral cortex, which terminate in the spinal cord. Those are the ones that will be found here. Those ones specifically are known as corticospinal tracts, as opposed to corticonuclear tracts that go to the brainstem. Corticospinal tracts occupy this region and that region of the spinal cord. This is the main one. This is a minor one. 85 to 90% are here. 10 to 15% are here. Let's just focus on that one because that's the main one. So that is where they occupy. Remember, that is what we call the lateral column. These neurons supply skeletal muscles. Extrapyramidal tracts are neurons which come from the brainstem and go to the spinal cord, and there are as many as the ones you can see in red apart from those two. We name them according to where they come from. I don't think I want to teach you any of their names, and so we can leave it there for the extrapyramidal tracts. Right, as we finish on the story of the spinal cord, let's talk about meninges of the spinal cord. The spinal meninges are just like the cranial meninges in some ways, although there are a few differences. So the same way we had dura mater, arachnid matter, and pia mater in the brain, we have a similar concept for the spinal cord. But there are a few things that I want to know with regard to the spinal cord meninges. We had agreed that dura mater is the most outside and pia mater is the most intimate with the CNS. The pia mater of the spinal cord usually will attach it to the spinal cord intimate. And originally that pia mater was extending all the way and attaching to the coccyx as well. But what happens to that pia mater as the spinal cord shortens? The region where the spinal cord is no longer there because the spinal cord has shortened will still have pia mater. But that pia mater will be like now a string. That string of pia mater that extend below the conus medullaris is what we call the terminal phylum. You can call it in Latin phylum terminale. It's the extension of the pia mater beyond the level of the conus medullaris. That makes the subarachnoid space below the level of conus medullaris to be very big. The subarachnoid space below the level of conus medullaris is known as the lumbar system. This lumbar system contains cerebrospinal fluid, but it also contains the cauda equina. Good. That's the story of the spinal cord. I will invite you for questions.